Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the hyperthermic disorders. So hyperthermic disorders, there are around 5 to 6 terminologies which we need to know. The first one being the heat edema. So what do you mean by heat edema? The heat edema is associated with the cutaneous vasodilation and the pooling of the interstitial fluid. It leads to the swelling of the hands, feet and the ankles. So what do we have? We have the cutaneous. So there is mainly the cutaneous vasodilation. So cutaneous vasodilation is what is seen, and along with it there is also the pooling of interstitial fluid. There is IF fluid accumulation. Because of that there can be swelling of the hands, feet and the ankles. The next what we have is the heat syncope. So heat syncope is where there is a vasodilation and the volume depletion. So vasodilation and the volume depletion, that is from sweating following an exercise or prolonged standing with consequent systemic and the cerebral hypotension. So heat syncope is also, the mechanism is associated with, there is the vasodilation and the volume depletion. There will be volume depletion. Whereas previously what we saw is there is a cutaneous vasodilation and the pooling of the ICF fluid, that was a heat edema. Syncope is where there is a volume depletion, that is from sweating, the exercise and the prolonged standing. Next we move on to the heat cramps. This, as we know, the heat cramps is associated with the deficiency of sodium. So deficiency of sodium, potassium and water, potassium as well as water. So all this is associated with the heat cramps and also the sodium, potassium, water. So heat cramps, the mechanism is the deficiency of the sodium, potassium and water, and this is at the intercellular level, so IC level. And it leads to the intermittent, painful and the involuntary spasmodic contractions of the skeletal muscles. So it can lead to the painful, involuntary. So that is painful. So it is painful, it is involuntary as well as it is spasmodic contractions. So this is nothing but the heat cramps. Next we look at the heat. We move on to the heat exhaustion. So what do you mean by heat exhaustion? So heat exhaustion is results from the prolonged strenuous activity. There is a water or salt depletion, but the thermoregulatory mechanisms are maintained. So heat exhaustion is when there is prolonged strenuous activity. So as the name suggests, exhaustion is when you exert your body to prolonged strenuous activity. There is water and salt depletion but thermoregulatory mechanisms. So thermoregulatory mechanism, this is an important keyword to know. Thermoregulation is maintained. Next is heat stroke. Heat stroke is when the thermoregulatory mechanisms are lost. So when the regulation is lost, it is nothing but, so what is the condition where the regulation is lost? Regulation is lost in case of the heat stroke and the temperature it goes above the 40.5 degrees Celsius. To learn and grow daily like this, please do subscribe.